Okay, everyone, welcome to another wonderful episode here at Doctors of Podiatry. We're all almost ready to embark on this wonderful transformation journey. I wanted to present this case to the world just because it's kind of unusual. We have seen cases as such, which we have not presented, but I'll go ahead and present the case. This is a young patient who came from out of town seeking solutions to essentially match left foot to right foot to left foot. For whatever reason, the right foot is a little bit different, right? We're going to take a look now, but you know, the idea is, I think more than anything, the emotional restoration, right? Patient is, what would you say, a little embarrassed, maybe?
I am embarrassed.
A little embarrassed, self-conscious, and you know, this is something very personal. Only the patient will understand. We also understand what the patients are seeking. Let's take a look here. So let's take a look at the left foot, right? The left foot is the normal, right? We'll call it the normal for all intents and purposes. The normal foot, right? Looks beautiful. So let's take a look at the right now. So what's different? Well, we have the bunion, number one. Number two, we have, as everyone can see, the width, right? Let's get them together there. The width of the right foot is, we measured it, it's about 2 centimeters wider, this foot, okay? So the idea is to thin out the foot, right? Work on what we'll call it the side tuck, a little tummy tuck for the side of the foot, and also this area here. And that will essentially, you know, thin out the entire foot, right? To make it look like this. Call it slimming, nip and tucking, call it whatever you want to call it. The idea is to match this foot to look like the good foot. And last but not least, we'll go ahead and of course address the bunion, right? Okay, everyone, so we're all done. How long? Hour and a half, 2 hours-ish. So we're done with the transformation. I'm gonna go ahead and show everyone what we basically, we're actually in our office-based surgical suite. Patient is awake. Say hi.
Hi.
There you go. Patient will walked in, we'll be walking out. Everything was done under local anesthesia, office-based surgical suite, walk in, walk out. No pin screws or plates, ladies and gentlemen. Correction of the bunion, right foot. We did what we call multiple, right, side tucks, basically a tummy tuck for the foot. This is a very unique case, as I said before. Our goal, our primary goal, was to match right to left, left to right foot. Patient was born like this, actually. And I would say in the last 10 years, right, 10, 15 years, that's when I guess everything was exacerbated, especially the development of the bunion, okay? So, Jennifer, let's kind of come around here, okay? I'm gonna go ahead, obviously this is not the after, it's a joke. This is actually the before, right? And what we're gonna go ahead and do is, again, just to kind of recap, correction of the bunion. You guys can't see here, but actually in the hind foot here, there was a little bulge, right? A lot of hypertrophy of skin, muscle, etc. And on the side, this is what was bothering the patient, right? This here, the Taylor's bunionette, the appearance, the lateral. I mean, this was really, really wide. Just to guys, you know, give you guys a better idea. This was the appearance of the left, again, just to refresh everyone's memory. The left was the normal one, and then the right was the not normal one. Okay, for all intents and purposes for the discussion here. And again, correction, minimally invasive correction, bunion deformity. And also, I don't know if you guys can see here in the back, there was a pouch in the back that was actually making the foot look even wider. And the patient will actually tie in the pictures that you sent me, you know, using the sandal shoes, and I think everyone's going to appreciate the problem.
Because that's
right?
not non-weight bearing, right?
Yes, this is correct. Yeah.
That's why you don't see that.
You don't see the, yes, exactly. So without further ado, okay, so let's go ahead and show you guys a foot, okay? So what we're looking at here, and Jennifer will stay right there, okay? That's before, and that's after. Okay, let's talk a little bit here. So this is all empty space. I don't know if you guys, Jen, if you can just, you know, kind of show everyone. This is a pouch. That's where the bone used to be, okay? That's where the bone used to be, and we shaved everything, and through this tiny little keyhole incision, there's another one here and another one here. The toe is straight. The toe will be left actually kind of like there, just because. Let's go ahead and show the left of the good one. We want the toe, right, to not be super duper straight like an arrow. We want it to kind of just follow the contour of the left. The foot, for anyone that's wondering, the right foot is super duper swollen at this point. It looks like a little papaya, right? So this is going to take at least, to see the outcome, to see this over here, 4 to 6 months, okay? And we were able to perform the side tuck on this side. No one, you guys can't really see this entire pouch, right? The side here, all of this was actually excised, and that's what we see. The lateral column is nice and straight. Foot slimming, that's what people like to call this. Foot slimming, foot contouring, and the truth is, for people out there, this is important. A lot of people will look at this video and see this video and say, why would someone do such a thing, right? I posted, in the last couple of days, a lot of the YouTube shorts. A lot of people, were criticizing, right? Ladies and gentlemen, this is something very personal, right? We offer these techniques to help people. That's our one of our goals at the core. We help. We're here to help, right? So a lot of people are not happy with the appearance of their feet. This particular young patient, in we'll say young 30s, she was just telling me that she did not show her feet to her significant other for a very, very long time. How long? How many years?
Over 10 years.
10 years. They were already married for a very long time. Think about that for a second. That's how deep this is, right? So when people come here seeking these aesthetic solutions, it's not, yes, we all want to have pretty feet, some people more than others, but at the core, there's the emotional restoration, which you cannot put a price, right? It's another body part, feet, right? No one talks about feet. It's very taboo-ish. And that's the reality. There's going to always be haters, naysayers, people that criticize, but at the end of the day, it's about the patient, right? And it's okay. That's always good for, controversy here and there is okay. But I want to, Jennifer, let's take another look here. Again, anesthesia, local anesthesia, office-based surgical suite. We basically contoured the right foot to look like the left. This is a beautiful transformation, not only on the side, but also on the medial aspect. I will definitely put a follow-up video to this. And, I think it's something very, very different from what Dr. Wagner usually presents, right? Here and there, we usually throw the, an aesthetic transformation. Okay?
Thank you.
Absolutely. So, again, one last final shot for everyone out there. This was the before and after, okay? No pin screws or plates. How's that possible? It's very possible, right? Okay, is there anything else that you would like to say to the world?
No,
just a couple thousand people. Amazing, really cool, right? Really, really great.
Great transformation.
Yeah. So, I'll definitely continue to keep everyone afloat. Again, complete makeover, so to speak. We're here to help. People that are not, simply not happy, whether it's toe lengthening, toe shortening, the removal of ugly corns. This is basically making feet, right, slimmer. Okay. If you guys have any questions, please ask away. As always, thank you for watching.